Well, welcome to the Aging Boomers. I'm your host, Frank Sampson. And of course, as you all know, on this show, we discuss so many of the issues facing boomers, their parents, and what, of course, is an aging population. So I'm very excited about our first guest. Before I introduce Tiffany, I want to let everybody know that today's show is sponsored by Senior Care Authority, a professional senior placement and elder care management organization that has a national network of advisors to help in determining the right path for seniors in receiving proper care or even supervision. So whether it's in-home care, assisted living, residential, or memory care, in order to get the necessary advice from a senior care advisor within the organization in your area, you can call Senior Care Authority at 888-809-1231, or you could go directly to seniorcareauthority.com. And boy, it's been a while. I've interviewed Tiffany on when I first started my radio show, which we've expanded to this podcast. So I want to reintroduce again Tiffany Matthews, who's the founder of Live Better Boomer, providing healthcare access and advocacy services. She is a patient advocate, a writer, and healthcare insider. She holds a dual BA in psychology and health and human services and a master's in journalism. Tiffany has been a social worker since 1995 and has worked in hospitals, nursing homes, and aging agencies. She has helped hundreds of families professionally and loved ones personally to navigate this maze, which we all call healthcare. She wants to help boomers and others get the best healthcare through teaching them to advocate for themselves. So, Tiffany, thank you so much for joining the Aging Boomers. I'm thrilled to have you on the show again.
I'm thrilled to be on the show, Frank, and thank you for inviting me back.
Yeah, no, it's been great. It's been too long. Sorry it's taken
Definitely.
so long. So, So I'm just going to start out by asking you what made you decide to become a patient advocate, and maybe explaining a little bit more what a patient advocate does.
Well, the thing is, I've been a social worker for over 20 years. Whether I was in a hospital or nursing home or anywhere, it didn't seem as if the help that seniors or boomers needed was always there. There was a ton of red tape to go through or paperwork, and many people didn't understand what they needed to do in order to get the services that they needed. So it kind of, for lack of a better term, made me upset. It's supposed to be a situation where people are supposed to walk in, get the help they need, and be able to leave happier. But it wasn't happening that way. Yeah. Therefore, I found a gap between services and wanted to help fill that gap for people. And therefore, my business of Live Better Boomer was born. Many hospital patients and nursing home residents have issues with what's going on and how they're being treated. Many families don't know how to advocate for better treatment or better health care benefits, that sort of thing. So my job, and I've taken it on as a career, that's how dedicated I am to it, my job is to find the gap of what's going on in their situations. Personally, I customize everything toward every customer and go in there and help and let them know what I can do for them. Patient advocates are supposed to do that kind of thing. They look out for the rights of the patient as opposed to the rights of the healthcare system. That's what social workers do. They're bound to the laws and policies of the healthcare system they work for, not to the needs of the patient.
I think it's great what you do. And, it's interesting. I was thinking about it. Growing up, I was just a young guy, and going to see the doctor with my mom or my dad. And And I just remember the way they looked up to doctors and other medical professionals. They at that time, it seemed they totally relied and believed in the doctors and other medical professionals. Whatever they said, they did, and they were 100% correct. Do you, I think it's changed, but I guess my question to you is if you agree that has changed, is it because of the boomer generation and just who they are, or has the medical profession industry changed?
I will tell you, Frank, that I do believe it's changing. I think we're seeing the last of people that really believe that whatever the doctor says is the gospel. The boomer generation is a revolutionary generation anyway. I mean, they fought, things about Vietnam and civil rights. I think that personality is embedded in a baby boomer. Therefore, I think they're the ones that are going to be able to change the healthcare system. They question, their providers and look for answers. And I say even question the answers. If you don't understand what's happening, ask. You have people like my grandmother who passed away in 2008. Whatever the doctor said, that was it. Oh, there's just a little of this going on and a little of that going on, but it's okay. He said it'll be fine, and it didn't turn out fine.
Right.
By the time we actually got to deal with the situation in its reality, it was too late. So I look at it as that attitude contributed to her illnesses. But I do believe that now it is changing. People are starting to ask questions, or they're starting to, realize that there are people like myself that can help you with your doctor's appointments or help you with the questions to ask. You don't, just because you have that little gown on and your butt's exposed doesn't mean you lose your power. You don't.
Yeah.
You can go in and, you're paying these people to care for you, whether it's through insurance or private pay. So you have every right to treat them as if they're giving you services, because they are. You are a consumer, and healthcare is a business.
Yeah.
So you have every right to treat it like you're going to McDonald's and you want your Big Mac a certain way.
Yeah.
If you walk out and your Big Mac is not correct, you're going to say something.
Right.
So you have every right to treat your healthcare provider the exact same way.
Yeah. So, I know you've put a lot of time and effort into helping people advocate for themselves, and we'll talk more about that in a minute. But there, I know when there's those out there that just don't know how to be aggressive, even if they're trying to advocate for themselves. Is that where your type of services can come in and help?
Absolutely. I kind of look at things where I see injustice, and I kind of become a pit bull with it, for lack of a better term, because when it's just unfair to me to see people that are in a vulnerable state treated in a way that is going to make them more vulnerable or more susceptible to sickness or, the business of healthcare. Again, when my family had to deal with my grandmother's passing, we were all worried about the business of healthcare instead of focusing on her. And it shouldn't be that way for anyone. It shouldn't be. People should be able to focus on their illness, and that's it. That's why I would like to come in and show people, listen, if you're in this particular situation, then you can handle it in this way. Whether it's doctor communication or a hospital stay or how to find a good nursing facility, advanced directives, all different kinds of things my business offers. And mainly my thing is to show people that you can catch more flies with honey than you can with vinegar. Right. But if you have to go the vinegar route, I'm there with you.
Yep.
I'm definitely there with you.
So that business, just to tell people, is called Live Better Boomer with an exclamation point, I may add, Live Better Boomer. So Tell us a little bit more about that. I know you just started talking about that, but talk about the concept, how people can be educated through it, and other services that you offer. Tell us about how to get to the website. Now's your time. Go ahead. Tell people all about it.
Okay. My inspiration for it, again, was my grandmother. I saw so many things happen with her. It was illness after illness after illness. And, a lot of people in the hospital, her insurance is about to run out and she's going to have to go. But yet, we don't have test results. We don't have any diagnosis. We don't have any information that we need to be able to go further in her treatment. So as a discharge planner at a hospital around the same time, I said, there's a lot of people that don't get that information. So I want to make sure that people know to step up and get that information. What I offer through Live Better Boomer is coaching, and I could coach you for as short a time as you like or as long of a time as you like. We can do it by phone. We can do it by email. And sometimes people need me or someone like me to jump in and just do everything. So I offer that as well. And I also offer what's called a VIP day, where someone can speak with me over the phone or come and meet with me. And we sit down for a few hours. We have lunch. We discuss everything. We discuss A to Z in what's going on with their situation. And we come up with a care plan as to what they need to do right then and right there. I also offer the care plans with my phone consultation. It'll give you a thorough and in-depth kind of solution to each issue that you're dealing with. So hopefully people will flock to it. The number of patient advocates or healthcare advocates is increasing. It's skyrocketing. Mm-hmm. But the unique part that I have over several others is that I've been a patient, I've been a healthcare insider as a social worker, and I've dealt with this, I've given this information personally to my family and friends. And I wouldn't give it to them, I wouldn't give it to anybody else if I couldn't give it to them.
Right.
So they can go to my website, which is lbbhealthcareadvocacy.com, or they can call me at 215-260-7782. And what I do is I give a free 30-minute consultation to see if they would be an appropriate customer and I'm an appropriate advocate for them.
That's great. I think it's wonderful. What would you say? I'm sure it's a wide range, but the types of people that you're dealing with and their situations, are they seniors whose maybe adult children aren't in the area? Are you working with the adult children directly? I mean, what's kind of the mix there?
Well, mainly I work with the adult children because of what I've seen. A lot of people that are patients and that are older, not that I wouldn't work with seniors directly, but a lot of seniors that I've encountered through my own experience say, well, my son or my daughter will handle that for me, because they don't want to worry about the business of healthcare while they're trying to get better. And I admire that. So I usually work with adult children or people that are chronically ill themselves, or, people that are newly insured. The healthcare law has passed, so if they're newly insured and need to know how to go about finding the appropriate healthcare plan for them, I can help with that. I'm trying to go into the area of veterans, and I want to see if I can assist them in different areas as well. That'll be coming in 2015, but right now mainly it's adult children and people that are chronically ill and caregivers. Caregivers definitely need help because they do such a wonderful thing. And, they need all the help that they can get because caregiving in itself, it's very stressful.
Can you give us some examples? I'm sure that you've seen some horror stories, and we certainly don't want you to mention names or hospital names or anything, but what are kind of some of the things that you've seen in hospitals or nursing homes where you've worked where someone really, really needed an advocate?
Well, I'll tell you actually a time that I had gotten written up on my job for trying to advocate for a patient. There was this little lady. She was about 80 years old, and it was the dead of winter outside. Now, she had come in on an emergency basis, so of course she didn't have any clothes. She didn't have any family. She didn't have any neighbors that she knew of. Really nice lady. So I had to go, and I had to discharge her. And she said, well, sweetheart, I don't have any clothing to go home in. I said, well, if you trust me, I will take your keys, and I will go to your home and gather your things. I won't touch a thing. I'll just go and get you an outfit and come right back out. She said, you would do that for me? I said, absolutely. So just to let my boss know, I said, the lady in such and such room doesn't have any clothes. I know she's slated to leave today. I told her that I would run and go get some. My boss said no. I said, well, she needs some clothing, so, if it's a problem of timing, I'll do it on my own time. Again, she said no. I said, well, why? She said, well, that woman could say that you stole this and that from her. And I said, I don't think it's going to happen that way. She just needs some clothing because it's the dead of winter. It's cold. She has nothing here. Well, here's what you can do. Put her in a bunch of hospital blankets, put her in a wheelchair, and send her home. And I was like, are you kidding me? Because if my family was treated that way, I'm not standing for that. And I would have took it to the highest level in that hospital of letting them know I wouldn't stand for that. I've seen in nursing homes residents being treated so badly. Some of them passed away in their treatment. There was a situation where I was working in a nursing home that there was a resident that was totally incapacitated. She could not move on her own, nothing. One of the aides went in to make her bed, and because the aide didn't feel like getting her out of bed, she kind of flipped the sheet, and the client went flying out of the bed and hit her head on the nightstand. Turns out, after a few days, that client passed away just because of that situation. So some of the things, and her daughter called me repeatedly and said, I can't believe this is happening. No one will give me any answers, because healthcare facilities, when something happens like that and they know they're at fault, the first thing they do is circle the wagons. They call legal. What do we do? How do we handle it? And you know what the one daughter had said?
What was that?
She said, Tiffany, I never even heard the words I'm sorry from them. And it's the truth. It's the truth. I was a part of that situation. No one ever apologized to her. And she said it looked like there was a gun to the back of her mother's head and somebody shot her. That's how bad the injury was. So some of the things that I've seen and I've noticed have been terrible. But what I do find is that if people have people with them or someone that's interested in what's going on, and that particular person makes their presence known regularly, there'll be a different level of treatment. I've seen it. I've witnessed it.
Oh, if they see you're asking the right questions, you know what you're talking about, there's a huge difference.
Oh, absolutely.
Yeah.
That worked with my grandmother. It worked with so many others. Because when you're trained to be a social worker, and this is just my opinion, when you're trained to be a social worker in a healthcare facility, whether it be a nursing home or hospital or anywhere else, you're trained to only go but so far. But in your gut, you know what's right and what's wrong to tell this family. And I have been a party to it. And there have been things that I could have said to a family to help them further, but it would have cost me my livelihood, and I couldn't afford that.
Right. Now, speaking about the hospitals, I mean, most hospitals do have patient advocates on their staff. So if a family member decides to bring somebody like you in as their, in a sense, third-party advocate, well, how do hospitals react to you if that's something that they already offer?
Well, the reason that they offer these patient advocates or patient navigators is to help patients. That is a goal. However, you have to do it within the confines of hospital or healthcare system policy. So there's still only but so far that you can go. For example, if a family needs, let's say they want to go to this particular nursing home, they heard great things about it, and this is exactly where they want their loved one. If it's a matter of the hospital or nursing home getting them out of that bed, they'll send them anywhere. Doesn't matter. Yeah. My job would be, wait a minute, you said that you could do this or that, or this patient's going to have to wait because they asked for a particular discharge plan to be met.
Right.
And my job would be to help that family or group of people to get the discharge plan met that they want, as opposed to accepting one that they don't want because the hospital said it. People give hospitals too much power when they go in. Again, it's a business and they're consumers. So back to the Big Mac example. If your Big Mac's not right, you're going to go back and say something. You can do the same thing here. Hospitals look at outside patient advocates as kind of like, for lack of a better term, a pain in the butt. Mm-hmm. They don't particularly care for us because when that, and this is just, again, my opinion, when we come in, they know that there's someone on this family's side that knows what they're speaking of and is going to press for it. Usually when patients come in, they get their surgery, they get their procedure, they're in and they're out of there, no matter what. Sometimes that goes well, sometimes it doesn't. But when you have a patient advocate from the outside for a family, they know that that's going to mean something. They're going to have to actually do the work that this patient deserves.
Right. So Tiffany, you're in the Philadelphia area, correct?
Correct.
Yeah. So, and you mentioned earlier that if someone is fine with phone consultation, you can help them. But what if someone really they're not in your area, they want to meet with somebody to accompany them or their family member in another area? What do you feel is the best way for someone to find a patient advocate like you? Maybe there might not be anybody like you, but to try to find somebody close like you.
Well, thank you, Frank. I appreciate that. There are outside agencies that will assist and do the same thing that I do. They may not have the same insight, but they are out there. But if people need to find those kinds of things, I have a package where someone can email me. They can email me once, 3 times, or 5 times, and I can help them find that resource, in their area. Or I could do things via phone for them. If they're okay with, choosing the package that I have, I call it, do you need Tiffany to do it all? I have no problem with doing that. As far as my presence, we'd have to get into that and speak about that, and possibly arrangements could be made.
Gotcha.
I have no problem with doing that. That's how committed I am to this. I've dedicated my career to it.
Great. And again, they could go to your website, which is www.LBB, which stands for the tell me again, Living Better Boomer. So
Live Better Boomer.
Live Better Boomer, LBB Healthcare Advocacy.com. And they could get your number on there and email and all that right on that website?
Yes. And they can also get a free gift, which is called a Healthcare Power Pack. And there are some things, some forms in there that they can fill out and take to their next healthcare appointment and have a better experience. There's, some questioning, some areas to find out, what are you actually concerned about? My whole, my adage is to be prepared before you even go, because you're only going to get a golden 5 to 7 minutes with the doctor. If you have everything written down, then you can address it all in that time. So I offer that. I offer a medication management form because I know my medications have increased in 2014, and it's hard to keep track sometimes. So I have a medication form where you can keep track, and also I have what's called a complete medical history, where you can fill out everything you possibly need to take to each healthcare provider so they know how to treat you.
Great. Tiffany, we're out of time, so thank you so much. I told you it was going to go by fast. We'll have you on again sooner, okay?
Please do, Frank. I'd love to talk with you again.
Yeah, that would
in your audience.
Yeah. So I want to thank Tiffany Matthews for joining us, and I want to thank you all for listening in to today's show, and be sure to share with friends and family about the show, Aging Boomers. You could do it, get to it on iTunes or iHeartRadio. You could also go to our website at agingboomers.com, or if you have an iPhone or Android phone, free download. Aging Boomers app, you could download it and be up to date on all of our shows. So I want to, again, thank Tiffany and thank all of you for joining us. Be safe out there, and we'll talk to y'all soon.